So antibiotics have drastically changed the practice of medicine. I mean, they've made hard to treat infections treatable. They've decreased the mortality rate by finding the right antibiotic to treat infections. But on another note, they can kind of increase the mortality rate if they're used wrong, and majority of the time antibiotics are used wrong. So according to the CDC, 20 to 50% of all antibiotics prescribed in the U.S. acute care hospitals are either unnecessary or inappropriate. And the misuse of antibiotics is also why antibiotic resistance is on the rise. And it's becoming harder to find antibiotics to treat certain infections or organisms. The CDC estimates that more than 2 million people are infected with antibiotic-resistant organisms, resulting in approximately 23,000 deaths annually. And it kind of reminds me, so my grandma had a hysterectomy, and then she got really sick with an infection, and it was a Pseudomonas infection. And the doctor came in and he said, "I don't really know what's going on with you yet. We don't know what type of infection you have." And he said, "I'm just going to throw every antibiotic at you that I can to try to get your fever under control and just the infection under control." And I mean, he's throwing all that at her, and that means, number one, he doesn't even know if something does start working, he didn't even know which antibiotic was helping the situation. Number two, he didn't even know what the infection was yet. If he could have just waited for even the gram stain results or something, I mean, to point him in the right direction, then he could have been able to narrow it down instead of just throwing a bunch of antibiotics and praying that something worked. I mean, that's just inappropriate, and that is what leads to antibiotic resistance. I don't know if I said it, but it ended up being she had an infection with Pseudomonas after she had a hysterectomy. Anyways, so improving the use of antibiotics is an important safety and public health issue for just hospitals and healthcare settings in general. There are hospital-based programs dedicated to improving antibiotic use, and they're called antibiotic stewardship programs. They optimize the treatment of infections and reduce adverse reactions associated with antibiotic use. And these programs are helping clinicians and physicians improve the quality of their patient care. And I found something else on the CDC's website, and it was the core elements of hospital stewardship programs. And let me see if I can find the core elements it stated were leadership, commitment, accountability, drug expertise, action, tracking, reporting, education. So I'm not for sure. I know St. Bernard's had one at one point in time, and I think Ben Childers did the presentation and stuff over it. I'm not really for sure who the pharmacy leader was. I know that the infectious disease doctor that comes in micro all the time is Dr. Norwood, and so he probably had something to do with it. But I do know that there was a presentation and one of these programs at St. Bernard's.